So our final speaker for this session is Akash Parekh, and he's going to be talking about protected non-clinical time radiation oncology residency program, and this comes from the University of Florida.
I know everyone's ready to get to a point. This is only a 4-minute talk. I'll be very quick. About 25 years ago, radiation oncology residency programs increased training length from about 3 years to 4 years, with the ACGME mandating 36 months of clinical time during the 4 years of training. As this transition occurred, many programs began to give residents some elective time during which residents could, for example, study for ABR exams, do research, or pursue other interests. Today, some programs give residents a whole year of this protected time, others just give a few months. So we surveyed all programs in the country to determine the amount of protected time residents get, as well as the perception of the value of this time to residents. Our surveyed population was all PGY5 residents at ACGME accredited programs in the US that are currently enrolling residents. Our goal was to have at least one resident response from each program in the country. To increase response rates, we give an upfront $15 Starbucks gift card to each resident just for opening the email or for being PGY5 residents. We send individual emails to each PGY5 resident, and in the email, we send a personalized link to the survey. So there's no official US News ranking of residency programs like there is for undergrad, but Doximity does publish a residency ranking list based on the reputation of programs. This list is oftentimes used by residents and applicants, and so where applicable, we made comparisons to the top 10 highest profile programs in the country compared to other programs. We had a 100% response rate from 82 programs in the country. We had a 68%, or 121 of 183 PGY5 residents in the country, thanks to the $15 Starbucks. 98% of programs had non-clinical elective time. The median amount of non-clinical elective time was 10 months in all programs, 12 months in top 10 programs, and 9 months in all other programs. Approximately 68% of programs have more than 6 months of non-clinical time for residents. Here I'm showing results for how satisfied residents are with their accomplishment during non-clinical time. The first table compares resident responses from top 10 compared to other programs, the next by the number of publications, and the next by the amount of non-clinical time. We see that about 3/4 of respondents from top 10 institutions are very satisfied with their accomplishment compared to about half of residents from other programs. Approximately 90% of residents with more than 5 publications are very satisfied. And we also see that the proportion of residents who are very satisfied increases as the amount of non-clinical time increases. We posed a theoretical question to the residents. We asked if, whether given the preference, would they give up their non-clinical time to shorten their residencies. Currently, this is not an option for any of us. However, we wanted to get an understanding of whether residents wanted to trade off this time in order to shorten the duration of their training. We see that about the majority of residents from top 10 institutions are not willing to give up this time, compared to about half of residents from other institutions. And then if we look at residents with 4 or more months of non-clinical time, the proportion that are willing to give up this time decreases as the amount of elective time increases. Few take-home points. The majority of programs have more than 6 months of this non-clinical time. Most programs in the top 10 have 12 months. And the great majority of residents are very satisfied with what they accomplished during their non-clinical months, to the point that most prefer a 4-year residency with more than 6 months of elective time compared to shortening their residency to 3 years. All of this suggests that programs should continue providing this time to residents, give thought to the structure of this, as well as reduce barriers that residents may experience to their productivity. On a program-specific note, as a result of this study, UF is restructuring to increase non-clinical time from 6 to 12 months. That's me with a fake smile. Thank you for listening, and happy to take any questions. Thank you to all the collaborators.